In this presentation, we talk a lot about copay accumulator adjustment policies as an insurance benefit design that is picking up momentum across insurers nationwide. So in the report that the AIDS Institute just recently released in March of this year, we provide context for what these policies are and how they impact patients, and why the policies are particularly detrimental to patients with really serious and chronic conditions. And I also share some key findings from the report and the research about the prevalence of copay accumulators, as well as the process that we undertook to determine if issuers were indeed implementing these policies within their plans. I also walk through some of the financial implications for both the patient and the health insurer and how they work across a plan year. So I think that for me, the key takeaway is that copay accumulators, when you look at how much a patient spends over the course of the year between the payments made by the patient themselves after their copay assistance has run out, and those copay assistance payments are still money and they're still being kept by the insurance company or the PBM. So when there's the copay accumulator in place versus when there isn't a copay accumulator in place, you see how much more money the insurance company or the PBM is collecting. And really, it's sometimes double or more. So it's a moneymaker for these insurance companies. And at the same time, it's a barrier to patient access.
The Federal Reserve, of all places, did a study that said that the average American household was ill-prepared to afford a $400 emergency expense. So not just even in the context of healthcare. So, we know that the average American is pretty price sensitive, and that's why, having access to copay support is so important for patients.
A growing amount of plans utilizing accumulator adjustment programs. That's evident by the work that Stephanie and the AIDS Institute did in their report, and showcases that and the great prevalence of it. And so because of that, we've seen this mass introduction of bills all across the country, 20 plus states that have introduced legislation that's similar to the 5 coming into this session, which would be West Virginia, Virginia, Illinois, Georgia, and Arizona. And then we've had 2 victories this year in Oklahoma and in Kentucky. But I think, as Stephanie mentioned, this is an issue that is something that is happening on both federal regulated plans and state regulated plans. State regulated plans is where the activity is, but anytime we pass a new bill or pass legislation, or members of Congress are seeing a bill introduced or talked about in their particular state, I think it does bubble up to them and know that this is something that they need to be resolving on a federal level, as well as something that can be done on a state level. And so anytime we get a bill introduced, it's not necessarily just going to help that state, it's going to be something that's going to help nationally. If you're looking for something that's going to really help patients right now, this is a bill that's going to do that. Is this going to be something that is going to fix the overall drug pricing landscape? No, that's something that's going to take some time for us to really develop and talk through with all the stakeholders. But if you're looking for something that's can be accomplished right now in a bipartisan way, this is something that can be done in one session, in one legislative session for Congress or for the particular states. And the great thing about this is it's a budget neutral way to do this.